is you and I getting together, making lifestyle changes that will change our bodies from the inside out. How many of us know that's real change? And a lot of us don't know what our bodies look like on the inside. And we're going to learn a little bit about the body. And I just want you to take a look at the body a little closer. So, what I'm talking about today is pain. You know, we all got it. We all have pain sometime. You know, whether it's a little ache here, a little ache there. Today I'm talking about the drugs that we choose to treat our pain. And one of the most common drugs that all of us choose are the Advils, the Ibuprophen, the Aleve. The real truth is, do they really work? Or are there other alternatives that we can choose to treat our pain? You know, the pharmaceutical industry has given us so much to choose from. Which one do we choose? And I'm going to try to lay some groundwork that is based in science as much as I can, because sometimes we don't even believe science. And I don't blame you, because there's a study that says this works, and then there's another study next week that says it doesn't. So let's take a look. And the drug I want to talk about today is chondroitin. Now, I don't get paid to push any drugs. Most of you think that doctors use certain drugs because they get paid. Really, I'm trying to just help us come to a decision about which drugs to pick off the shelf when we're in the pharmacy. So, a lot of us have pain. One of the pains that I have frequently is knee pain. Yep, I got osteoarthritis of the knee. You hear it all the time on the news or on ads from pharmaceutical companies or drug companies trying to sell their drug for osteoarthritis. But what exactly is osteoarthritis? Boy, that's a tongue twister. Osteoarthritis. Well, what osteoarthritis is, or what it ain't, is anything that feels good. Osteoarthritis is when you get inflammation of the joint, and one joint actually ends up causing the other bone to rub on each other. Let me say it another way. We got these little cushions in our back, and here they are right here. We call them, can you see that? They're little discs. We've got these discs in our back that prevent bone from rubbing on top of bone. That's smart, isn't it? It's a cushion. And what happens over time, because we are always active, we're running around, we're doing sports, and we're doing them at even earlier ages, we're finding that by the time we're 30 or 40, that joint has worn down. And as a result, when the joint becomes inflamed, you get pain. Simple as that. It's simple. Joint degradation leads to pain. And they use this fancy term, osteoarthritis. Well, what happens when you get osteoarthritis? We usually grab the Aleve, the Ibuprophen, the aspirin, the Tylenol. But the scientists have been looking at this new drug called Chondroitin. Chondroitin. And it's made actually from the bone of animals. So if you're a vegan, you may want to stay clear of it. In any event, there was a study done in Switzerland, and what we want to look at is the results of the study. There were about 600 people that entered the study. So that's a so-so number. And in this study, they took a group of people and took them into their hospital, their clinic in Switzerland, and they actually gave them the chondroitin. That's not so difficult, it's not so scientific. And they gave them some Vada and chondroitin. And what they did is they followed them over a period of time, 1.5 years, and they then monthly determined whether this group of people got better after taking the chondroitin. Well, the end result was that they did. But as I said, these studies are sometimes not worth the paper they're written on, because, like a lot of things, there are some problems with the study in that before they looked at these cases, the real physical exam or the real determining whether these people had arthritis was not done. So if you were to go out there and look on the web, you'd find things on both sides. You'd find some people who say it works. Oh my goodness, it works. And others that say it does nothing. So I think the jury is still out whether chondroitin works. I think that it's not clear whether chondroitin works, but what we do know is that little pill does work for your dog or your puppy. So if you buy a bottle and it doesn't work, you can always give it to your dog.